Hello everyone. Uh, this is a patient with shoulder pain again. Somebody who was 50-year-old, non-diabetic. There's no history of trauma, no history of fever, no sign of red flag. Presented to a very short history of shoulder pain. The history runs to not more than 2 weeks without any history of trauma. She has developed a spontaneous shoulder pain. For which she had taken some over-the-counter analgesics, for which she has not responded. And the on clinical examination, her impingement test was positive. Nothing more to suggest anything acute, actually. So there was no swelling. There was some complaint about having a little bit of numbness on the palmar aspect of the hand. Other than that, she didn't have anything. Okay. So, as usual, going for the neutral examination, ultrasound examination of the shoulder, the supraspinatus was looking a little bit thinned out, in the sense there was a volume loss, significant volume loss at its insertion. Significant volume loss at its insertion onto the greater tuberosity means that there could be possibly a partial or full thickness tear, or sometimes, for your surprise, it could be a complete tear of the supraspinatus. That is always a possibility, right? As always, trying to move the probe anterior to posterior, try to examine the complete thickness of the supraspinatus there. There are a bit of fibers, whether these are stable, united fibers along with the myotendinous junction, needs to be examined by stress physicians like the CRAS, right? Now, examining the same tendon on the short axis, the long axis and short axis views assumes importance. This is a bit obese patient. So not much could be examined. Again, it's like trying to examine it on the dynamic position. Tracing it anterior to posterior and trying to see there is a tear. That's the full thickness tear which I'm trying to look at. That's a full thickness tear. In between, there is a hypoechogenic area between these two areas of hyperechogenicity. This is a normal tendon which is actually retracted. There is a small bit of hyperechogenicity. That is the full thickness tear. It's not a complete tear, it's a full thickness tear. The difference between a complete and a full thickness tear is that the vertical height of the tear being torn is called the full thickness tear. The width of the tendon being torn is complete tear. Okay. Here, this is not a complete tear. This is the full thickness tear, where on a static image you could see there is a small little opening there between the two edges of the supraspinatus muscle of the tendon, right? Trying to examine the tendon anterior to posterior, appreciate the tendon tear in between, right? Once you appreciate, try to look at the range of movements. Range of movements are pretty normal, except for the pain. So I try to look at the short axis and the long axis view in detail. The moment I saw there was no further pathology, I decided to go for just a bursa injection, avoiding steroid for fear of any further tear. So avoiding steroid was the goal here. So I did a bursa injection for pain relief as well as proliferation of the tendon. Okay, proliferation of the tendon is more important to give pain relief. So I decided to go for injection with dextrose, 5% dextrose being the choice, 5% dextrose injection correctly into the subacromial subdeltoid bursa. This is the subacromial subdeltoid bursa, particularly in a very, very thinned out tendon onto the insertion. You always have the challenge of actually putting it appropriately, correctly into the subacromial bursa. So for which you can actually go in for needling from this side to this side, okay? Not essentially onto the greater tuberosity. You can actually go closer to the myotendinous junction, okay? That is a better way of needling and depositing your injection in the appropriate space, right? Exactly. This is what is mean. The tendon should never be disturbed There's no tenotomy which is required. You are actually putting your 5% dextrose around 4 ml into the subacromial burst along with 2 ml of 2% lignocaine for pain relief. She reported after 5 days with nearly 90% of pain relief. She is able to lift her shoulder without any pain. Thank you.